So I don't think anyone would argue with the fact that clinical reasoning is probably the most valuable skill as a clinician. Yes, we have to develop the skills, the practical skills, the knowledge that underpins those skills, the ability to communicate, all of those things. But clinical reasoning is really that fundamental skill set that helps us make good decisions, make plans with the patient, and be able to deliver the treatment in the right sequence, on the right order, on the right day, at the right time for the right person. So all of these things can be whittled back to the ability to have good clinical reasoning. Now, unfortunately, as educators here at ACE, we always struggle with this concept of clinical reasoning because how do you teach it? How do you teach someone to take all the bits of information and knowledge that they've accumulated over the course of their career and integrate it in an effective way so that they can use it in clinical practice? And it's something that we've always struggled with. So I've spent a bit of time thinking about this and trying to simplify the idea of clinical reasoning down to basically a structure that you could give to somebody and say, look, if you want to get better at this, here's the things to focus on. The more time I've spent thinking about this, the more I've realized there's probably three fundamentals that if you really wanted to focus on developing your clinical reasoning, this would be where you'd start. Now, of course, there's a lot more than this you can do to improve your clinical reasoning ability. But I think if you thinking about yourself as a clinician and going, you know what, I struggle making good decisions, I struggle knowing where to go or how to understand what to do next. These are the three things that I would recommend focusing on, spending your time on, immersing yourself in, studying, and trying to get better at. Now, the first one is going to seem like a really obvious one, which is anatomy. If you know the anatomy of the human body really, really well, it gives you the components, right? So we're going to start very basic here. It gives you the components of the machine. Now, I get in trouble all the time from different people online, having a go at me about relating or likening the human body to a machine. And it is not like a machine because it's way more complex than any other machine on the planet. But if we think about how something works, it has components to it. So if I give you an analogy of a machine, it's only for the simplicity of this example. But the components of that machine, the components of our body, are what make up the body or the machine. And so we have to understand what they all are, how they interact with one another. Okay, that's our foundational piece of information. I would say this to any practitioner. It doesn't matter whether you've just graduated or whether you've been in the game for 30 years. You can't know that part of what you do in clinical practice well enough. Go back, really study, revise, and get to know the anatomy really well. The relationship between those parts is critical to making good clinically reasoned decisions. The second part is pathophysiology, not pathology, not physiology, pathophysiology. I'm being specific here for a reason. Pathophysiology is the study of the human body and how it reacts when it's being damaged, injured, or under stress, if I want a better term. So when we look at pathophysiology, and if we're looking at it from a purely manual therapy perspective for the point of this example, we might look at something like tendinopathies. Well, with pathophysiology, we'd want to get a really good, clear understanding of how tendons behave when they're pathological. What's the pain pattern like? How long does it take to heal? What are the inputs that we can apply to improve the healing rate? What are the aggravating and easing factors of the pathology? Okay, so if we understand a type of tissue-based pathology really well, we can then better understand how we can manage that person better through their recovery. Okay, so it's not just tendons. This goes for bones, muscles, ligaments, blood vessels, nerves, everything that we work with as manual therapists. Okay, so really, this is a huge field of study, by the way. Like, it's not something you just pick up a book for a couple of weeks and you go, right, I've got pathophysiology. You'd have to be very specific, very strategic, work your way through the different regions of the body, consider all the different pathologies that might present, and then dive into how does that pathology represent itself in the physiology? How do we get that understanding of pathophysiology so that we can understand how the body is likely to behave when it's been injured or when something's gone wrong? And so we can then insert ourselves into that timeline and recognize what we can do to improve the rate of that healing or support that process. Okay, so we've got anatomy, we've got pathophysiology, and that's a huge one to study. You'll never reach the end of that one. And then the last one is mechanisms of effect. Okay, so mechanisms of effect is now the practical bit. So if we can understand the body and its components, anatomy, if we can understand what happens when those components are damaged, pathophysiology, and if we can then understand what we do as a manual therapist, as a health practitioner, the different tools, the different modalities that we use, not just how to do them, that's kind of the simple bit. The difficult bit is how do they work and why? Okay, so understanding, if you're a massage therapist, understanding how massage interacts with the sensory nervous system and the flow on effect from that. What are the different, not just sensory effects, but what are the different chemical and neurological effects that are triggered by that sensory input? If you're using dry needling, for example, we've talked about this in the podcast plenty of times. What's the different mechanisms of effect with dry needling? What different systems and processes are affected by the needle being inserted into the body? And then how are those systems stimulated by the needle in ways that we might use it? It goes on to joint mobilization, manipulation, strapping, taping, whole range of different things. And so regardless of what your modalities are, you can spend a lot of time diving into the mechanisms of effect. And not only is it interesting, I guarantee you it's really fascinating stuff, but that's the key, right? If we take our understanding of the components, our understanding of what happens when the components break or injured or under stress, under load, and then we look at the different mechanisms of effect of the different modalities we have, we can then start to marry these things together intelligently. Okay, so if we have someone, using my example of a tendinopathy earlier, and we know that they're at a certain point on the timeline of recovery for that tendinopathy, then we might be able to insert the appropriate intervention because we understand the different mechanisms of effect. It might not be a modality, it might be exercise, it might be just load modification, it might be any number of different things. But we have to understand those three things: the parts, how they behave when they're upset, broken, injured, and then what are the effects that we can generate through the different modalities that we use as XYZ practitioner. It doesn't matter what you do. So really getting good at clinical reasoning is not about going and acquiring a whole new set of skills, a whole new range of different modalities that we might apply. While those are useful, far better to dive deep into what you already know and really understand it well. So again, you can make those intelligent decisions using your clinical reasoning to have more positive impacts on the pathophysiology, so we can improve the function of the anatomy, working backwards in that sequence. Okay, so you want to get better at clinical reasoning? They're the things: anatomy, pathophysiology, and mechanisms of effect.